Hello everyone, my name is Colton Townsley, and I'm presenting to you my theory infograph on the theory of interpersonal relations. Starting with Hildegard Paplau, born September 1st, 1909, she was an American nurse who served with the American Nursing Association as the executive director and president. She hailed as the mother of psychiatric nursing for her work and contributions to the nursing profession. Her work was heavily influenced by Maslow's, Freud's, and Sullivan's interpersonal and psychoanalytical models. Her theory focused on treating the patient through relationship stages. She fully believed that nursing was a healing art, and the interpersonal relationship worked well because the patient and nurse worked towards a common goal. The main ideas of this theory start with the orientation phase. This phase is when the patient and nurse first meet. The nurse-patient relationship is new and unfamiliar, and creates building blocks in order for the other phases to progress. During the identification phase, there is a deeper understanding of the patient's needs. This stage will show proactiveness in education and professional standards, helping to decrease loneliness. During the exploitation phase, the patient gets comfortable asking for help and considers the nurse an important part of the recovery process. The final phase is resolution. In this phase, the patient is no longer dependent on the care provided by the nurse, which leads to the closing of the nurse-patient relationship. In addition to phases, the nurse takes on integral roles, starting with the stranger role where the nurse is an unfamiliar caregiver to the patient, and the process of building trust starts here. The resource person and the teacher role are shared, as the nurse is there to provide resources and education. The leader role will help guide the patient's care plan, and the nurse now has influence in this role, becoming an authoritative figure. And the last two roles are surrogate and counselor. These roles provide the patient with a feeling of a friend that cares about the patient's health, even after discharge. All of these phases and roles are focused on the holistic approach of treating a patient as a whole, and being there for when the patient needs it, and becoming a helping hand during recovery. Some assumptions of this theory include the maturing of the patient and the nurse through the care process, as well as the obvious prolonged interactions with patients that extend past the traditional methods of nursing. A theoretical assertion of this theory is that the patient must progress through stages consecutively. A nurse can't simply jump phases without establishing a foundation. However, roles are fluid and can survive through the care process. For utility and testability, I have listed the study that explains the impact of holistic-centered care versus general nursing care on a collection of advanced gastric cancer patients. Patients who receive holistic care during their treatment scored lower than those who receive generalistic care. This includes lowered anxiety levels, depression, pain, with increased quality of sleep, self-care, and quality of life. This exemplifies the critical importance of the nurse-patient relationship, as it aims to not only heal the patient physically, but mentally and spiritually. Moving to generalizability, Hildegard Paplau's theory can be universally applied to the entire field of healthcare, and not just nursing. The focus of the nurse-patient relationship is to create a caring environment in which the patient and nurse both feel comfortable and confident during care. That is why this theory can be applied so widely. Because of this, it can also be applied to some cases outside healthcare. For example, a mentorship or apprenticeship in which the relationship of knowledge, trust, and respect is established to continue towards a common goal. Some strengths for this theory include creating a comforting environment for the patient. This helps by reducing stress and emotional demand. It also centers the patient during care, showing the patient is the highest priority for care and not just a diagnosis being treated, which results in increased patient adherence to the current treatment and post-discharge plans. Weaknesses regarding this theory would be the possibility to overstep boundaries. The desire to create a nurse-patient relationship may come off too strong, and certain actions or comments may have the opposite effect. Additionally, the nurse could experience emotional burnout. This may be a result of multiple patients at once and attempting to upkeep the nurse-patient relationships, or having a matured nurse-patient relationship where the patient is either deceased or becomes discharged, which may have a lasting negative effect on the nurse. Below are some references for anybody who wants to continue their education on my theory. Otherwise, thank you all for listening. I look forward to exploring everyone else's infographic.